This video is all about skeletal injuries. We have 206 bones in our body. Then we have ligaments that hold our joints together. We have muscles that help us move and tendons that hold the muscles to the bones. Any of these structures can get damaged. Bones can break, tendons, muscles and ligaments can tear, twist and overstretch. A strain or a sprain is a common injury. It is when we overstretch or twist a tendon or ligament. Signs and symptoms can include pain, swelling, bruising and loss of movement or power. If someone has injured themselves, have a look at the area for these symptoms, and if there are two of that particular body part, then compare the injured area to the equivalent uninjured area. For example, if someone has hurt their ankle, have a look and compare both ankles to see if one looks swollen. If they are experiencing pain, bruising or swelling, then treat using the RICE acronym. RICE stands for rest, ice, comfortable support and elevation. Rest, get them to stop moving. Ice, this reduces swelling. A bag of peas or ice pack is perfect. Comfortable support or compression using a conforming bandage or a sling is best. Then elevation. This also reduces the swelling. Most sprains and strains will heal on their own over a few weeks. If the injury is on a joint, then it may be dislocated. The symptoms are very similar to a sprain or strain. The person will be in a lot of pain and have lack of movement. The area will be swollen and bruised. There will be obvious deformity compared to the other joint and they may go into shock. Do not attempt to put the joint back into place. Keep the area immobilised, apply ice and call 999 if they are unable to move. Broken bones may be easy to spot if the bone is sticking out of the skin or they have an extreme deformity, but most breaks look very similar to a sprain or strain and it is impossible to tell the difference without an X-ray. If you are unsure, then treat it the same way as a sprain or a strain. If there is obvious deformity, extreme pain or the skin is broken, then make the patient comfortable and call 999. Support the area with something soft and treat for shock if they feel sick, dizzy, look pale and clammy. If a bone is protruding from the skin and it is bleeding, then treat it in the same manner as an embedded object. Get 2 bandages and place them either side of the bone, applying pressure together and downwards to stop the bleeding. To recap, soft tissue injuries usually present as swelling, bruising, pain and loss of power. Treat with rest, ice, comfortable support and elevation. Thank you for listening. I hope you found this helpful.